some weeks ago, which means that suspected COVID-19 emergencies can now be diagnosed on site within 1 hour. And you have the result. And this will drastically reduce the turnaround time and waiting time to allow better utilization of observation rooms in the hospitals. This is a major advancement in handling the distress experienced by patients arriving as emergencies in these hospitals who would normally have to wait for a day or two before they get their result. The University of Abuja Teaching Hospital in Gwagwalada has also found access to supplementary medical oxygen supply, courtesy of the generosity of the Nigerian Air Force, who supplies them with oxygen from their plant in Yola. On Tuesday, the 25th of August 2020, Africa was certified polio-free, having passed through the formal standardized certification process, where Nigeria was the last of 47 member states of the African region to meet the criteria. These include no wild poliovirus detected in the last 4 years in Nigeria, but also an obligation on us to faithfully adhere to keeping and expanding routine immunization and active disease surveillance and containment. This achievement was made possible with the strong commitment of the President of the Federal Republic, who personally vaccinated his own grandchild to openly demonstrate that those few drops of vaccines are not harmful but life-saving. His Excellency also delivered a virtual keynote address at the formal event and accepted the certification as a fulfillment of his own promise that he would not bequeath a polio-endemic country to his successor. We are appreciative and proud of this achievement of being polio-free, and I thank the staff and management of National Primary Healthcare Development Agency for all their efforts and sacrifice. We shall not relent in our efforts to ensure that Nigeria remains polio-free. We shall be deploying the material and human resource assets from the polio eradication effort to surveillance and fighting other disease outbreaks, including the fight against COVID-19 pandemic. Nigeria also participated in the World Health Organization African Regional Conference, held virtually due to the demands of the time and chaired by the Minister of Health of the Congo. I led the Nigerian team and participated in discussions which centered around various subjects, including COVID-19 and progress made in conversations around vaccines and implementing the African Regional Sickle Cell Strategy. We shall sustain our interest in development around COVID-19 vaccine as the world seeks opportunity, and discuss with other countries as the world seeks opportunities to exchange ideas with countries and organizations investing in new knowledge. Training and retraining on infection prevention and control is ongoing in all our facilities, as well as ensuring availability of personal protective equipment as an investment to continue the reduction in health worker infection. I renew my call on all our health workers to ensure judicious and prudent use of these PPE materials while observing their full IPC measures. Finally, I wish to remind all of us that COVID-19 is still with us and might be for a foreseeable future till there is a vaccine available for it. We are exploring options and opportunities to see that when the vaccines are available, Nigeria will be among the beneficiaries. The NAFDAC is also pursuing, trying to reach the international maturity level to assure that the products and processes that come out of research work in Nigeria towards development of vaccine candidates are realizable and that they meet the required standards. With the imperative to reopen our economy, relax local and international air travel to support restoration of livelihood, the experience in other countries is that we must all be vigilant and do all that is possible not to lose our attention to preserving lives or to lose the gains we have made over the months. The onus lies not only on government, but is a shared responsibility with the populace. The safest, easiest, cheapest option of achieving a balance between saving livelihoods and saving lives remains adherence to non-pharmaceutical measures, as we have preached so many times. With these measures, we can balance our indices, can balance and uphold our indices even as we reopen our economy. Thank you for your attention.
Good evening, Chairman, sir, honorable ministers, gentlemen of the press, and ladies. My focus actually today is on the business, the role of the business space, as our office space, the role of the employer towards their employee. Well, of course, we know that COVID had a telling impact not only on the health sector, but this global economy. And this has actually significantly slowed down the demand and supplies of many commodities, causing setback for several employers and employees. We've had where people have disengaged their staff because they are not opening. The gradual easing of lockdown has allowed for the progressive resumption of economic activities. Though we are still a long way to go, nevertheless, the role of businesses in halting the spread of COVID-19 is very critical. Businesses are unique in positions to encourage the behavioral change among our populations towards the stopping of the spread of COVID. So as a business tries to navigate the financial and operational challenges of the pandemic, we have the COVID guideline for businesses and employers in Nigeria. Well, you can access this in our website, covid19.ncdc.gov.ng, and the guidelines are there. The guidelines actually reflect the sector-specific recommendations and practices to prevent the spread of COVID in the workplace, as well as give some confidence to employers in ensuring that the health and safety of their employees and customers is assured. Earlier in the year, we launched the Take Responsibility campaign. This idea is, the idea behind this is for individuals to adopt the COVID preventive measures and for businesses and other entities to also take responsibilities by adapting key messages to encourage the behavioral change in their society. Some of the things that employers can realistically do to protect their staff and customers and business include mandatory use of face masks within the office premises and having temperature checks at the entry point of the business environment, providing and ensuring there's hand washing facility and alcohol-based sanitizers, displaying signages, reminding staff and visitors to maintain good hygiene and respiratory hygiene. Then also staggering working hours That's having alternate days of working for different groups of people, shift. Then developing physical distancing strategies within the office environment, developing an infectious disease preparedness action plan to reduce the risk of exposure in the workplace, and communicating this to all employees, including helplines, the state helplines, sample collection centers, where we have, like in the banking sector, where we have regular face-to-face contact with customers, they are to ensure that they have the necessary protective equipment to keep them and the customers safe, and discouraging the use of work pens, computers, phones, even the headphones. Because we have, in some call centers, we have headphones that are shared. That's what we want the employers to discourage. Then also ensuring that the staff members know the spots for the symptoms of COVID and have a clear understanding of what it is to feel unwell and what to do when you feel unwell. And also have maybe like a holding area within your office space if you have an incident, where to keep your staff pending when they can go for the sample collection, or pending when they can be taken out of the premises. Businesses must think through how they can be part of the solution as Nigeria resumes the routine activities. We are not going to, COVID is not going to hold us to ransom. We have to start our lives. Everyone has a part to play in sustaining the gains that we have made thus far, and we cannot afford to regress. We urge unions, associations, and bodies representing various sectors to adapt these guidelines to their members. It's only a physically and mentally healthy workforce that can help our economy recover from the impacts of COVID. Thank you.
The Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So today I'll be briefly talking about the role of private and public institutions in curbing the spread of COVID-19. As we relax the restrictions further, it is important that we remember the importance of adhering to non-pharmaceutical interventions. We continue to observe an overwhelming non-compliance with the non-pharmaceutical interventions that we have put in place. And people in public spaces are not wearing face masks. Even if they do, they are not wearing them properly. This, no doubt, is endangering many lives and challenging the effort of the PTF in mitigating the pandemic in Nigeria. We know that scientific data has shown conclusively that if you really want to fight COVID, you need to have these interventions in place, such as wearing a mask, physical distancing, avoiding mass gatherings, etc. They are a highly efficient form of prevention. When people ask me when is a vaccine going to be available, I tell them there's already a vaccine. It's right there with you in your hands. And that vaccine are the simple non-pharmaceutical interventions we continue to push. It's right there with you. So today we are appealing to businesses and corporate institutions to take responsibility by strictly enforcing the no mask, no entry, no mask, no service rule in order to curb the spread of COVID-19. We encourage people to work safely. We encourage managers to ensure that their staff are working safely in an environment free of COVID. We are appealing to private and public sector institutions to inculcate safer working habits, which still allows for work productivity, such as virtual meetings, remote working, doorstep deliveries, the use of online platforms, limiting occupancy in spaces to 75% or less, limiting the number of people in enclosed spaces such as elevators, providing on-site temperature checks, hand sanitizers, and hand washing facilities, ensuring your workers have access to PPE, and ensuring that when they do wear face masks, they are worn properly and they are worn at all times. Our attitude and behavior towards these non-pharmaceutical interventions will no doubt determine how long it takes before we get over this pandemic. We don't want to have a long tail. We all want to return to normal. The PTF will continue to work with federal and state agencies to ensure all government facilities are compliant. We appeal to private companies and institutions to strictly enforce these life-saving measures in their spaces. And we will continue to work with law enforcement agencies where this is clearly not being followed. We must partner to establish a safe working environment for all of us. Thank you.
The chair of the PTF, distinguished honorable ministers, members of the PTF, ladies and gentlemen of the press, good evening. Since the announcement by the Honorable Minister of Aviation a few weeks ago that international flights will resume anytime from the 29th of August, the aviation sector has worked assiduously to be ready for this date. And the aviation sector, including the airports, are ready to resume on 29. However, we have other non-aviation logistics we are still working at, mostly to do with the COVID protocols, the tests, and also the online platform. We need to get this all ready and in place so that we'll have a smooth and efficient resumption of the international flights without difficulties for all the passengers. So for this reason, unfortunately, I have to let you know the resumption date has been shifted by 1 week to 5th of September. 5th of September, which is now a sacrosanct date. The initial announcement was anytime from the 29th. Now we have fixed a date, 5th of September, to ensure that a sacrosanct date for the resumption of international flights. In due course, very shortly, we'll be announcing the protocols once these logistics are done, the protocols for the resumption, and also we'll be giving further details on the principles of reciprocity that were mentioned. We are looking at the list, we are working on that, and together in a couple of days, hopefully early next week, we'll release this. That's the announcement from the aviation. Thank you.
Thank you very much, DG NCAA, on behalf of the aviation sector. Now we are switching the format to the launch of the transparency dashboards. We will take 2 video messages from Mr. Asue Igodalo, Chairman, Nigerian Economic Summit Group, NESG, and Mrs. Agi Mokwede, Director, Africa Initiative for Governance, AIG. So are we ready for the 2 messages?
Distinguished ladies and gentlemen, it is indeed a great pleasure to welcome you all to this important and historic occasion, a truly historic occasion. Today, the NESG and the private sector are making history with the launch of the COVID-19 Incidents and Response Tracker and Dashboard. At the beginning of the COVID-19 pandemic, the Nigerian Economic Summit Group and its private sector partners swung into action by providing both financial and technical support to governments at all levels to help control the spread and cushion the economic implications of the virus. The NESG and its partners undertook a series of engagements, interventions, and initiatives with other members of the private sector and other stakeholders, which led to different coalitions, including the Coalition Against COVID-19, CACOVID. The CACOVID, as from inception, mobilized members of the private sector and private sector resources to support government's efforts, increase general public awareness, and provide direct support to private and public healthcare's ability to respond to the crisis. The NESG, in collaboration with the Africa Initiative for Governance, AIG, designed the COVID-19 Incident and Response Tracker and Dashboard. The dashboard primarily reveals the resource requirements across the 36 states of the Federation and the Federal Capital Territory to enable respective subnational governments, alongside the federal government and donors, identify needs and gaps that exist in 3 critical priority areas: testing, treatment and isolation, and contact tracing and tracking. I would like to thank the Africa Initiative for Governance, our funding partner for this project. I thank you most sincerely. I also thank most sincerely the Presidential Task Force on COVID-19, the Nigerian Governors Forum, and each state governor and their commissioners for health, the Nigeria Center for Disease Control, members in the private sector, donor collaborators for their input and contribution towards the successful eradication of the COVID-19 scourge in Nigeria. The creation of this dashboard and the joint collaboration by all enablers typifies achievable successes whenever the private and public sector actively collaborates. We sincerely look forward to many similar impactful and development-enhancing collaboration. I thank you all for coming to this launch today, and I'm sincerely grateful to all our partners. Thank you and welcome.
AIG, the Africa Initiative for Governance, is a non-profit organization pursuing public sector transformation for improved socioeconomic performance. We provide financing and capacity building to support public sector reform initiatives across Nigeria. We are pleased to have partnered with the NESG and the NCDC towards the development of the Nigeria COVID-19 Incidents and Response Tracker Dashboard. This landmark initiative is a demonstration of what the Nigerian public sector, in partnership with the private sector, is capable of achieving. The COVID-19 pandemic has compelled governments around the world to implement unprecedented response measures to protect lives and forestall economic collapse. Nigeria faces similar challenges, which are made worse by the poor state of our public healthcare system and limited financial resources. Fortunately, our country, led by the Presidential Task Force on COVID-19 and the NCDC, promptly instituted emergency health responses and other interventions which have bought time and space to enable the country strengthen its capacity to fight the pandemic. The NCDC continues to demonstrate through initiatives such as the COVID-19 tracker that it is one public sector institution that is deserving of private sector support. It is clear, as many other countries across the world have realized, that Nigeria will have to rethink its policy priorities, spend smarter, and retool itself to deal with the far-reaching effects of this crisis. COVID-19 is a burning platform calling for change. Here in Nigeria, it is important that we review existing systems and take the opportunity to push forward for change so that we are more resilient and better prepared to handle this crisis and others that may come in future. The launch of the dashboard today marks a significant milestone in our country's response to the COVID-19 pandemic.
Thank you. We'll skip the UNDP video address. I understand it's not here yet. Then we'll take, for a few minutes, the video presentation on Nigeria COVID-19 Incidents and Response Tracker dashboard, followed by the One UN Basket Fund dashboard. So in successive order, let's take the two video clips.